Do you want to know the most dangerous thing that happens when older adults stop having sex? It's not just loneliness. It's not just losing intimacy. It's weakened cardiovascular health, accelerated cognitive decline, gradually weakening immune system, and worst of all, your lifespan may be shortening without you even realizing it. After 60, sexual health isn't just a bedroom matter. It's a critical indicator of your overall health, quality of life, and emotional connection. Ignoring it means ignoring yourself. But here's good news. It's never too late to change. Today, I'll share 7 habits you need to stop immediately to protect and improve your sexual health. At the end of this video, I'll share an extremely simple tip that can help restore your confidence, boost desire, and improve bonding with your partner. If this content is helpful for you or someone you care about, please hit like, subscribe to the channel, and leave a 1 in the comments section. Now, let's explore the 7 habits you need to eliminate right away. The first habit you need to stop immediately is staying silent and suffering when facing physiological issues. Are you pretending everything is fine? When erectile function begins to decline, or you experience dryness, lack of desire, many people choose silence. They feel embarrassed. They're reluctant to speak up. They fear being judged. They consider it an inevitable part of aging and don't dare seek help. This is a serious mistake. When you ignore these issues, they don't just persist, but become worse. Erectile dysfunction can be an early warning sign of cardiovascular disease. Untreated vaginal dryness can lead to prolonged pain and infections, and when these problems remain unaddressed, they create a vicious cycle of self-doubt, anxiety, and distance in relationships. In fact, over 70% of people above 60 experience at least one sexual function issue, yet only about 25% seek help. This is unfortunate because modern medicine offers many effective solutions. Instead of suffering in silence, consult a urologist, gynecologist, or sexual health specialist. Solutions such as erectile dysfunction medications, hormone therapy, lubricating gels, or psychological counseling can bring significant changes to your sexual quality of life. Remember, seeking help isn't a sign of weakness, but rather a demonstration of wisdom and concern for your health. The second habit destroying your sexual health is a sedentary lifestyle. The problem isn't just back pain or knee joints, it's about restricted blood flow to the genital organs, decreased testosterone, weakened pelvic floor muscles. Physical activity plays a crucial role in maintaining healthy sexual function. Exercise improves blood circulation to all body parts, including the genitals. It also balances hormones, enhances strength and flexibility, improves mood and confidence, all essential factors for a fulfilling sex life. Science has clearly demonstrated men over 50 who exercise regularly have a 30% lower risk of erectile dysfunction compared to inactive individuals. For women, regular exercise increases sexual desire, improves sensitivity, and enhances the ability to achieve orgasm. A notable case involved a 72-year-old patient complaining about complete loss of erectile function. Instead of immediately prescribing medication, I suggested a 30-day walking program. After just 4 weeks of walking 30 minutes daily, he reported significant improvements in his erectile function. The increased blood flow made a difference that medication alone couldn't achieve. Instead of remaining sedentary, start with gentle exercises like walking 30 minutes daily. Yoga is an excellent choice because it not only builds strength and flexibility, but also reduces stress and improves mind-body connection. Kegel exercises, strengthening the pelvic floor muscles, provide tremendous benefits for sexual health in both men and women. For women, they enhance sensation and prevent incontinence. For men, they can improve erections and ejaculatory control. Remember, it's never too late to start exercising. Even small changes can bring significant results for your sexual health. The third habit weakening your sexual vitality is poor nutrition. What you put into your body directly affects your sexual ability, especially after age 60. Consuming too many processed foods, refined sugars, and unhealthy fats doesn't just cause weight gain, it clogs arteries, reducing blood flow to the genital organs. This is particularly dangerous because sexual function heavily depends on good circulation. Moreover, an unhealthy diet can cause hormonal imbalances, increase inflammation in the body, and even affect mood and energy levels, all of which can diminish sexual desire and performance. I recently treated a 65-year-old patient with persistent erectile dysfunction that wasn't responding well to medication. When analyzing his diet, we discovered it was full of processed foods and sugary drinks. After 3 months following a Mediterranean diet, his need for ED medication was reduced by half. The improvement in blood circulation made a significant difference. Research from the Journal of Sexual Medicine shows that people following a Mediterranean diet, rich in fruits, vegetables, whole grains, olive oil, fish, and nuts, have significantly lower rates of sexual dysfunction compared to those following a typical Western diet. Instead of continuing harmful eating habits, prioritize foods that support sexual health. Zinc-rich foods like oysters, lean red meat, and pumpkin seeds help boost testosterone production. Fatty fish like salmon, mackerel, and herring contain omega-3s that enhance blood flow. Antioxidant-rich fruits and vegetables like blueberries, strawberries, spinach, and kale help protect blood vessels. Nuts, especially almonds and walnuts, provide essential fatty acids and L-arginine, an amino acid that supports blood flow. Remember, changing your diet doesn't mean giving up all your favorite foods. It's about making smarter choices to nourish your body and maintain your sexual health. The fourth destructive habit is undervaluing sleep. Only sleeping 4 to 5 hours each night? You're shortening your own vitality. Many people don't realize the intimate connection between sleep quality and sexual health, especially as we age. Lack of sleep or poor sleep quality doesn't just make you tired, it triggers a series of problems that directly affect your sex life. When you don't get enough sleep, your body produces less testosterone, a crucial hormone for sexual desire in both men and women. At the same time, sleep deprivation increases cortisol levels, the stress hormone that's an enemy of sexual desire. A breakthrough study from the University of Chicago found that men sleeping less than 5 hours per night for a week experienced a 10–15% reduction in testosterone levels compared to when they were well rested. For women, lack of sleep reduces sexual desire and increases the likelihood of vaginal dryness. One of my patients, a 63-year-old executive with a busy schedule, complained about completely losing his sexual desire. Tracking his sleep revealed he was averaging only 4.5 hours of sleep per night. After implementing a strict sleep hygiene regimen for 6 weeks, his desire returned significantly. No medication needed, just proper rest. Instead of continuing to neglect sleep, prioritize it as an essential component of sexual health. Establish a regular sleep schedule, trying to go to bed and wake up at the same time each day. Create an ideal sleep environment, cool, dark, and quiet. Avoid electronic devices at least 1 hour before bedtime, as blue light can inhibit melatonin production, the hormone that helps regulate sleep. Limit caffeine and alcohol in the afternoon and evening. Try relaxation techniques like meditation, deep breathing, or a warm bath before bedtime. Remember, the goal isn't just to sleep more, but to sleep better. Sleep quality is as important as the number of hours you sleep. When you prioritize sleep, you're directly investing in your sexual health and overall well-being. The fifth habit, destroying intimate connection, is avoiding communication about sex with your partner. Do you still talk openly with your partner about intimacy? If not, you're not alone. But that silence is the biggest barrier. No one can guess what you're feeling: embarrassment, pain, worry, or disinterest. Many older couples never discuss their needs, desires, or changes in their sex lives. They may feel ashamed, fear hurting their partner's feelings, or simply don't know how to start the conversation. As a result, misunderstandings accumulate, needs go unmet, and the emotional distance grows. This silence is especially harmful as bodies change with age. Women may experience discomfort from vaginal dryness but say nothing. Men may worry about maintaining erections but keep their concerns to themselves. Both may be experiencing changes in desire or preferences but never share them with each other. A couple in their late 60s came to my office after not having sex for 5 years. When I spoke with them separately, I discovered both still desired intimacy, but each assumed the other wasn't interested. This communication gap cost them years of connection, that could have been easily resolved through honest conversation. Research from the Kinsey Institute shows that couples who regularly communicate about their sex lives report higher satisfaction levels, not just in the bedroom, but in the entire relationship. Open communication creates deeper intimacy, builds trust, and allows both partners to adapt to age-related changes. Instead of avoiding these important conversations, start with gentle discussions, perhaps after watching a movie with romantic scenes or reading an article about sexual health. Use I statements instead of you statements to avoid sounding accusatory. For example, I miss when we used to hug more often, instead of, you never hug me anymore. Listen actively and non-judgmentally when your partner shares. Experiment with small gestures like holding hands, hugging, or massage to rebuild physical connection. Consider couples counseling if communication remains difficult. Remember, communication isn't just about stating problems, but finding solutions together. When you open up to your partner, you create opportunities to build a new sexual relationship that may be different from what you experienced when younger, but still meaningful and satisfying. The sixth destructive habit is over-reliance on alcohol or tobacco. A glass of wine each evening? No problem. But too much will kill your physiological response. While a glass of wine might help you relax and create a romantic atmosphere, excessive drinking does the opposite. Alcohol is a central nervous system depressant that reduces sexual response and inhibits orgasm. For men, heavy drinking can cause difficulty achieving and maintaining erections. For women, it can reduce sensitivity and ability to reach orgasm. Tobacco is even more harmful. Smoking damages blood vessels throughout the body, including those supplying blood to sexual organs. Studies show male smokers have twice the risk of erectile dysfunction compared to non-smokers. For women, smoking can reduce blood flow to the vagina and clitoris, decreasing sensitivity and making orgasm more difficult to achieve. A 65-year-old patient who enjoyed 2 or 3 cocktails every evening complained of gradually worsening erectile function over 2 years. When he reduced his alcohol consumption to just 1 drink on weekends, his erectile function improved dramatically within just 3 weeks. The connection was undeniable. Additionally, both alcohol and tobacco can cause other health problems like hypertension, heart disease, and cancer, which also affect sexual health. Instead of continuing to ignore mental health, practice stress reduction techniques daily such as meditation, yoga, or deep breathing. Just 10-15 minutes daily can make a significant difference. Engage in activities that bring joy and meaning, such as hobbies, volunteering, or spending time with loved ones and friends. Maintain social connections, which are crucial for mental health and overall sense of well-being. Consider psychological counseling or cognitive behavioral therapy, CBT, if you're struggling with anxiety or depression. If you're taking medications affecting sexual function, talk to your doctor about adjusting dosages or changing medications. Remember, mind and body are intimately connected, especially regarding sexuality. Caring for your mental health isn't a luxury but a foundation for healthy sexuality after 60. The seventh and perhaps most underestimated habit destroying sexual health after 60 is ignoring stress and mental health. Stress doesn't just make you irritable and sleepless, it also makes desire disappear. Chronic stress, anxiety, and depression affect not only your mood, but also directly impact sexual desire and function. When stressed, your body produces cortisol, a hormone that reduces sexual desire and can interfere with the production of sex hormones. Furthermore, when your mind is filled with worries and negative thoughts, it's difficult to relax and enjoy intimacy. Mental health issues such as depression are particularly common in older adults and can significantly reduce sexual desire. Unfortunately, many medications used to treat depression can also cause sexual side effects, creating a difficult cycle to break. I worked with a 68-year-old patient who experienced a complete loss of desire after retirement. Although there were no physical issues, psychological evaluation revealed undiagnosed depression. After appropriate treatment combining therapy and carefully selected medication, his desire gradually returned, along with his general joy for life. Research from the American Journal of Psychiatry shows that people who regularly practice mindfulness and stress reduction techniques report higher levels of sexual satisfaction and fewer sexual dysfunctions. Instead of continuing to ignore mental health, practice daily stress reduction techniques such as meditation, yoga, or deep breathing. Just 10-15 minutes each day can make a significant difference. Engage in activities that bring joy and meaning, such as hobbies, volunteering, or spending time with loved ones and friends. Maintain social connections, important for mental health and overall sense of well-being. Consider psychological counseling or cognitive behavioral therapy, CBT, if you're struggling with anxiety or depression. If you're taking medications affecting sexual function, talk to your doctor about adjusting dosages or changing medications. Remember, mind and body are intimately connected, especially regarding sexuality. Caring for your mental health isn't a luxury, but a foundation for healthy sexuality after age 60. Now that you understand the 7 habits to eliminate, you might be wondering, where do I start? Here's the simple tip I promised, a small but powerful habit you can implement today. Dedicate 5 minutes daily to either performing Kegel exercises to strengthen your pelvic floor muscles or making an intentional loving gesture toward your partner. Kegel exercises aren't just for women. Both men and women benefit from strengthening pelvic floor muscles. For women, they improve vaginal sensitivity, prevent incontinence, and enhance orgasms. For men, they can improve erections and ejaculatory control. To perform Kegels, imagine you're trying to stop your urine flow midstream. Tighten those muscles, hold for 3 or 5 seconds, then relax. Repeat 10-15 times, 2-3 times daily. You can do this exercise anywhere, while watching TV, reading, or even sitting at your desk. If you choose the loving gesture option, make it something simple but meaningful. A 5-minute shoulder massage, holding hands while watching TV, a sincere compliment about something you admire, or a tight hug held for at least 30 seconds, which releases oxytocin, the bonding hormone. The beauty of this 5-minute practice is that it addresses multiple issues simultaneously. It improves blood flow to genital areas, increases feel-good hormones, reduces stress, and rebuilds connection with your partner. One patient told me this simple 5-minute daily practice was like turning on a light in a room that had been dark for years. The physical and emotional benefits compound over time, creating a positive cycle that enhances both sexual health and overall well-being. Let's recap the 7 habits you must stop now for better sexual health after 60. Ignoring physiological issues, maintaining a sedentary lifestyle, following an unhealthy diet, neglecting sleep, avoiding communication with your partner, relying too much on alcohol or tobacco, and ignoring stress and mental health. Remember, sexual health isn't just about sex. It's about vitality, connection, and overall well-being. The decline many experience isn't inevitable. It's often the result of habits that can be changed at any age. I've seen patients in their 70s and even 80s reclaim satisfying intimate lives by addressing these habits. One 78-year-old patient told me, "I feel more alive now than I did at 60, after implementing these changes for just 6 months." The journey to better sexual health after 60 starts with a single step, choosing one habit to change today. Whether it's scheduling that doctor's appointment you've been avoiding, starting a daily walking routine, improving your diet, prioritizing sleep, initiating an honest conversation with your partner, reducing alcohol, or practicing stress management, each positive change creates momentum toward better health. Your body has an incredible capacity to heal and respond at any age. Don't let another day pass surrendering to misconceptions about aging and sexuality. You deserve a fulfilling, intimate life for all your years. If you found this information valuable, please hit the like button, subscribe to the channel for more evidence-based health advice, and share this video with someone who might benefit. End the comments if you're committed to making at least one change starting today. Your sexual health journey isn't over. In many ways, it's just beginning.